Hello everyone. In today's class we are going to learn about congenital syphilis, the laws, the pathogenesis, the early congenital syphilis, the late congenital syphilis, and the diagnosis and treatment part. I guess this is the last class for clinical syphilis. We have already covered the primary, secondary and tertiary syphilis and the pathogenesis and the conceptual part of the syphilis. There are few laws in the congenital syphilis which were proposed in the past and we should know them. They are time and again asked in various vivas. So the first law is the Coley's law. This law was proposed by Abraham Coley in 1837 and it states a syphilitic infant could transmit the disease to a previously healthy wet nurse but never to his or her own mother. So first we should know what is a wet nurse. In past times they hired mothers or lactating mothers to feed their infant. It was a sign of royalty. This means that the mother is already having the immunity and the newborn baby with the syphilis with open sores, the mucus patches and all the manifestations might infect the healthy wet nurse but can't infect his own mother. Moving on to the next law, which is known as Profita's law. It was proposed in 1865 and it states a healthy infant to a syphilitic mother is immune to the disease. Now, historically, Profita's law was proposed to explain that some infants of syphilitic mother did not have any clinical features. But it was noticed that these infants may later develop clinical syphilitic signs and symptoms. So, in modern understanding, this law stands false. Next law is the Kassovitz law, and it was proposed in 1876 by Max Kassovitz. It states an untreated syphilitic mother tends to improve on her past performances. Now we have to understand this. Now let's say there is a female who has the infection. She is having syphilis and she conceives. So the first child she conceives might end in a miscarriage, say in the 5th month. Now the second child she conceives may end in a stillbirth in the 8th month. The third child will be delivered as congenital syphilis but lives for a few months and dies early. The fourth one will be delivered with congenital syphilis and that child lives. The fifth one that she delivers will be a healthy infant. So we can see that how the fate of the child she delivered improves with the order of pregnancy, the order of the child. Now this was all about the laws of congenital syphilis. We already know there is early congenital syphilis and late congenital syphilis, which I have explained in my first class of syphilis. Early congenital syphilis is due to direct infection by the Treponema pallidum. That means the bacteria enters the circulation of the fetus from the mother via the placenta. So this bypasses the primary syphilis. So whatever features we see in early congenital syphilis is almost like secondary syphilis. And this happens when the mother gets infected in late pregnancy, like after 20 weeks. Before 20 weeks, the placenta is not that permeable to the bacteria. After 20 weeks, it gets permeable, and most probable is after 8 months of gestation. Now, late congenital syphilis is due to hypersensitivity of the infection, the untreated infection of the fetus. This happens when the mother gets infected before 8 months of gestation, most commonly 4 to 8 months. So just to remember, early congenital syphilis when the mother gets infection in the late pregnancy, and late congenital syphilis when mother gets infected in the early pregnancy. Now, in early congenital syphilis, the infant will present to the clinician or will develop the signs and symptoms within 2 years of the age, and it is most commonly around 3 weeks of age of the infant. Almost all presents within 3 months of age of the patient. Late congenital syphilitic child will present after 2 years of age. Now, congenital syphilis bypasses the primary stage because the infection has directly entered the blood. There is no sexual route. So, primary syphilis will not be there. The early congenital syphilis is almost analogous to secondary syphilis stage, and the late congenital syphilis is almost analogous to the tertiary stage of the adult syphilis. Now, moving on to the clinical presentation and the clinical features, which are the characteristic features of early congenital and late congenital syphilis. We'll start with the early congenital syphilis. Now, one thing to remember is that the earlier the presentation in early congenital syphilis, the poorer is the prognosis. Now, this is a representative picture which shows an infant with marasmic syphilis. They have wrinkled and wizened look, pot belly, almost like an old age person. So, marasmic syphilis. Then there is a condition known as pemphigus syphiliticus. Traditionally, this is the only stage of syphilis where you can see vesicles, bullae, and erosions. This was an interesting case. We can see the bulla and the erosion of the palms and soles, which is the most common site to be involved. The discharge or the fluid from these erosions will be teeming with the treponemes. Now we can see the famous snuffles, which is syphilitic rhinitis due to syphilitic mucus patches. And these are the mucus patches which is intraoral. These are the erosive lesions around the anus. The most common rash of early congenital syphilis is papillosquamous, and palms and soles are the most common site to be involved. In general, any papillosquamous lesion over palms and soles, think syphilis in a proper background history. The bones are also involved in early congenital syphilis, and there is mainly osteochondritis and periostitis. There are various signs and names associated with the bony changes. This is a case report where you can see a healthy baby, is just keeping the hands immobile in a flexed manner. This is pseudoparalysis of Parrot. Parrot was the first person who described this clinical feature in 1866, and these were the bony changes or the X-ray changes which led to the diagnosis and supported the diagnosis. We can see the metaphyseal osteochondritis here, and this is the metaphyseal band, which is also sometimes known as sawtooth appearance of the metaphyseal band. This is the metaphyseal osteitis, and lastly the periostitis. The trypanosoma pallidum causes inflammatory osteochondritis of the growing metaphysis. This leads to irregular vascularity, leading to sclerotic and then alternating with resorptive zones in the metaphysis. This leads to the jagged metaphysis edge, leading to sawtooth appearance. Now this is another case report which very beautifully depicts the Wimberger sign. This is the proximal end and the medial side of tibia, which shows rarefaction of the bone, and this is known as Wimberger sign. Now in periostitis, there is periosteal reaction. There is recurrent inflammatory episodes due to trypanosoma pallidum. The periosteum gets lifted and there is deposition of bone in concentric manner. So that leads to what is known as onion peel appearance. So there is concentric layers of bone deposition in episodic manner leading to the onion peel appearance. Now we are going to learn about the clinical characteristics of the late congenital syphilis. The syphilitic phases, this is the classical phase. It has been taken from the public CDC public image library. This is the most common feature. It is the interstitial keratitis. It starts at around 5 to 15 years of age and presents with pain, lacrimation, photophobia. The involvement of ear is due to the neural deafness due to the involvement of 8th nerve. These are the upper permanent central incisors which are pegged or screwdriver shaped. They are shorter and widely spaced and they are known as Hutchinson's teeth. These three together, interstitial keratitis, neural deafness and Hutchinson's teeth, are known as Hutchinson's triad, which is very commonly asked. So we can just draw a triangle to remember it. The same organs like the eye, it has another feature known as salmon patch. This is due to vascularization of the cornea at the periphery that gives a dull pink appearance at the periphery. It is known as salmon patch. The ears can also be involved due by the osteochondritis of the otic capsule. Otic capsule is something that it is a part of the temporal bone that encapsulates the semicircular canals. So when it is involved, there might be again neural deafness. If these ossicles are involved, there can be conductive deafness. In teeth, there is another feature known as mulberry molars or the moon's molars. These are the first lower molars or the sixth year molars where the cusps are underdeveloped and poorly enameled. So they are very prone to caries. Some other features which are very characteristic of syphilitic facies is the saddle nose due to the gummaceous destruction of the septum of the nose. The maxilla of the patient of the face is short and there is high arched palate. This leads to the undue prominence of the mandible. Now short maxilla and prominent mandible leads to something known as bulldog facies. So in syphilis, bulldog facies can also be seen. Now coming to the forehead, there is frontal and parietal bossing of the scalp. Due to the osteitis and periostitis and all kinds of inflammation of the scalp bones. The frontal bossing which is more prominent in this picture. Here we can see the frontal bossing. It is also known as Olympian brow. Olympian statues were the Greek sculptures in ancient times and they had a very prominent brow and thus the name is derived from there. There are many other features in late congenital syphilis. This is the Clutton's joint. These are painless swelling of the knee joints due to the synovitis that leads to effusion in the joint. They are painless and non-tender and they are usually bilateral. Another term we know is saber shin. There is this anterior bowing of tibia and this is known as saber shin. Saber is a particular type of sword which is a bit curved. So this resemblance in the shape leads to the name. There is anterior bowing of tibia and this is due to periostitis and new bone formation in the periosteal region of the tibia. Another result of bone inflammation is the Du Bois sign. This is inward curved little finger. This is known as Du Bois sign. Previously it was very considered characteristic like Hutchinson's teeth, but now it has become in a non-specific sign. Now the clavicle. The medial part of the clavicle is thickened again due to the inflammatory process and they are known as Higao-Minaki's sign. So clinically there will be very prominent clavicle in the medial side. Next is the scaphoid scapulae. You can see this is the lateral angle of the scapula, and this, the border of the scapula should have been like this, the medial border, but it is curved. This is known as scaphoid scapula. There is one very important complication in late congenital syphilis which might be asked in your exam. It is paroxysmal cold hemoglobinuria. It is an autoimmune hemolytic anemia. In this, what happens? There is a biphasic antibody in the patient. It is known as Donath-Landsteiner autoantibody. This antibody binds with the RBC when the temperature is cold, especially in the acral areas, because these regions, the acral regions, are more cold than the central part of the body. Now, this complex of RBC and the Donath-Landsteiner autoantibody will activate the complement system. When the complement is activated, the RBC is lysed. Now, the lysed RBC releases its hemoglobin. All this is happening inside the blood vessel, that is intravascular. So, free hemoglobin lies in the blood vessels. This is carried by the blood to the kidney. Now, the kidney will try to excrete this, and this leads to the cola colored urine, the blackish or reddish black urine, and this is very important sign of paroxysmal hemoglobinuria. This all process leads to some symptoms like fever, chills, abdominal pain, body ache, and black urine. This also causes severe acute hemolytic anemia. So all the signs of hemolytic anemia like pallor, jaundice, tachycardia, and dyspnea will be seen in the patient. Now the kidney gets compromised by trying to excrete this, and it may land into acute kidney failure. Now if the cause is syphilis, since we are reading syphilis here, the cause is syphilis, you have to treat syphilis and the patient improves. Now we'll end the class here. I wanted to cover the treatment part as well of congenital syphilis, but since the lecture is becoming too long, I end the class here. There are many concept building lectures in the channel. You may go through it. Keep learning. Be happy. Bye for now.